cannot deviate from what information we have and what systems we are putting in place in order to address this challenge and really truly flatten the curve. This is our ultimate goal. And we are busy focusing on exactly that and doing everything we can to support the most vulnerable homeless population that is sleeping on the streets now. In fact, our goal is to really target those who are over 60 and those who have underlying conditions who are not yet in our shelter system. The ability to provide sufficient capacity for the expanded shelter bed programs, the hotels, the food, the cleaning, the management, the oversight, the work, the resources, the wraparound supportive services, all that we have to do to expand our capacity to address this issue is a very challenging thing to do when many of the folks that we have working in this field are already still showing up to work and still working very hard to help keep our existing programs running. And we have to also protect them. So this is more complicated than opening up every hotel room in San Francisco and making it available. If that were possible, we would do it in a heartbeat. But there are a lot of other things that come with doing this right. And ultimately, our goal is to focus on our public health experts and the recommendations there, and to do this in a way that truly provides the help and the support that we need to those who are most vulnerable in order to get through this. So I want to thank you all again for your understanding and your patience as we grapple with these challenges. And I also want to say, as the weekend approaches, today is Friday. I think it's going to rain. We see the sun is out. And I just want to remind people how important it is to follow the directive. And we are in week 2 of this stay-at-home order, and we know that it's not easy. When you're in line at the grocery stores, follow the social distancing order. When you are out and you're at a park or walking around your neighborhoods, please continue to follow the social distancing order. This is so critical to the success of our city. When you think about what is happening in San Francisco in comparison to places like New York, people are, the numbers in New York, sadly, have skyrocketed out of control. In the United States, have basically surpassed other countries in the world. And here in San Francisco, we have been able to really, I think, do a tremendous job in maintaining numbers that people thought would be completely out of control at this time. Yes, it will get worse before it gets better. Yes, we will have challenges ahead. But the reason why everyone is praising San Francisco for our swift action in closing down the city and looking at the numbers and what's happening is because everyone here knew how important it was to follow the instructions, and everyone accommodated the request for the most part in our city, and that is what's going to get us through. That's what's going to make us successful as a city. That is what's going to keep us safe because we know that when we come together and we work to follow the instructions provided, that we will get through this. And the last thing I want to say before I ask Susan Phillips to come up is, put positivity out into the world. This situation is like nothing that I think anyone alive today has ever experienced in their lifetime. And it can be scary for some people, especially people who are struggling financially and have a lot of uncertainty about their future. There's a lot of anxiety. There's a lot of frustration. There's a lot of fear. There's a lot of things that are going on in various people's lives and household. And what I think is important is that when we are going through all of this, yes, there's work that needs to be done, and the people here at the Emergency Operations Center are working every single day to do that work, to make things better for all of us. But at the same time, we need to continue to put out that positive energy, to put out that love and goodness in the world. An example is exactly what we know. Some neighbors gather and they just, open their windows or come outside the front of their places at, I think, 7 o'clock, and they just start clapping and thanking the healthcare workers. And we saw on the Salesforce Tower, there was clapping to thank the healthcare workers. We lit up City Hall in blue to thank the healthcare workers. I think that if we continue to put out positive energy and love and a feeling of togetherness and comfort, that is going to help us through. Because we can drown out all the negativity, all the hate, all the other stuff that divides us by focusing on what matters. This really has put so many things into perspective, even for me, and how short life can be, how precious it is that we are all here today, and what we can do with our voices, with our commitment, with our passion, how we can really demonstrate it by example, and how we can help others get through it. And I want to bring up the note that I mentioned before that I received from a neighbor that just basically said, here's my cell phone number, here's my email address. If you need someone to run errands, if you need a grocery store run, the pharmacy, or even just someone to talk to, I'm here. And that means a lot. It means a lot to someone who may not have received a visitor this whole time. And so I just wanted to just remind us to be good to each other. The kindness of so many of you has gone a long way and really helped people get through it. Because when I say we'll get through it together when we support and uplift one another. That's exactly what we need to do as time goes on, because this is going to get even harder. And the only way we're going to get through this is really by trying to focus on supporting each other, uplifting each other, and just really trying to push for a more positive outlook on things. Because there will be a time that we will wake up and life will be back to what we know and love. And so at this time, I'd like to ask from the Department of Department of Public Health, filling in for Dr. Grant Koufax, we have Susan Phillips, Dr. Susan Phillips.
Good morning. I'm Dr. Susan Phillip, Deputy Health Officer for San Francisco. Thank you, Mayor Breed. I'd like to update San Franciscans today on a few developments in our ongoing work to respond to coronavirus and protect our community. Today, there are 497 San Francisco residents with confirmed cases of coronavirus. 6 of them are in hospitals across the city, and about half of these are in ICUs. Very sadly, 7 San Franciscans have died from the disease. I'd like to send condolences on behalf of the entire health department to their families and friends. As we continue to fight the coronavirus pandemic, I'd like to remind you again, as Dr. Koufax has, that our top priorities remain reducing the spread of the virus in the community, protecting vulnerable populations, healthcare workers, and first responders, preparing our health systems for an expected surge of hospital patients, and expanding our testing abilities and capabilities. In all of this work, we seek continuously to do better as we incorporate the latest science, data, and facts into our actions and recommendations. We have known from the very start that this is a rapidly evolving situation, and that continues to be true. We're working very quickly to integrate new information all the time and adjust our recommendations accordingly so that we're providing the very best, most up-to-date information and advice that we can. The issues of masks and face coverings is a good example of how we've done this. Yesterday, Bay Area health officers joined together to recommend that members of the public cover their mouths and nose when they go outside to do essential tasks. Data shows that cloth face coverings, when combined with physical distance and hand washing, which we have always recommended, may prevent additional transmission of the coronavirus. The state health department issued new guidance this week as well. The key point is this: if you cover your face, you're protecting other people around you. We know now that people may be contagious before they have symptoms, or that people with coronavirus may get only mildly sick. You could be one of those people. I could be one of those people. Covering our noses and mouths with cloth is a good way of being a good neighbor and a community member. I want to stress that this is not a substitute for physical distancing, staying at home, and washing our hands. These remain the mainstays of our work in prevention, but it is an additional tool and one we should use. I also want to stress that medical masks, such as isolation masks or N95 masks, are still in very short supply and must be reserved for healthcare workers and first responders. A face covering can be a made-at-home cloth mask, a bandana, a towel, a scarf. Anything that will absorb droplets is just fine. This is new advice, and we know that there will be questions. There will be frequently asked questions on sfgov.org, and those will be continued to be updated. I also want to give an update on Laguna Honda. We remain very concerned about a growing outbreak at Laguna Honda Hospital and are continuing to do everything we can to protect the health of the residents and the staff there. We've gathered some of the best minds in infectious disease control to help us prevent and manage the community spread of this virus. We've had some of the world's foremost experts right here in San Francisco at the health department at UCSF, and furthermore, we're expanding to work with the California Department of Health and with other experts around the country. We're very grateful for this support. We also know that long-term care centers are at great risk across the country. So if we can make progress here, it will benefit people in other places. Experts from the California Department of Public Health and the U.S. Centers for Disease Control and Prevention are on site at Laguna Honda and will remain there to assist in the improvement and implementation of the highest level of infection control measures. They're also working very closely with us, advising how we should do contact tracing investigations and giving us recommendations for further improved preparedness and response going forward. We are all working together on a preparedness and response plan and protocols for all of the long-term care facilities in San Francisco. I also want to give you an update that as of today, Laguna Honda has a total of 12 confirmed cases of coronavirus. 10 of these cases are among staff and 2 are among residents. Of staff, 7 have been in patient care positions and 3 have not. As we speak, the California Department of Public Health and the Centers for Disease Control and Prevention are on site, again, helping us, as I mentioned, with contact tracing and investigations. To date, 94 patients have been tested throughout the hospital, and to date, 278 staff members have been tested, either by DPH or by their own provider. Every staff member on the 2 units where staff have been sick have been tested. Every patient on the unit where there was a sick patient has been tested. We are working with CDC again and identifying and testing those staff and residents they are most concerned may have had exposure to coronavirus. Some people have asked a very reasonable question. Why don't we test everyone on campus? In an outbreak situation, we must prioritize both clinical decisions and resources. The first people to be tested will be those who are showing symptoms or those who have been exposed to a person with coronavirus. The contact tracing investigations will tell us who these people are. Those test results drive further action and decision making. We're committed to keeping you all informed about this progress. Testing has been taking place every day this week as the contact tracing investigations continue. Testing has taken place on the 4 South unit among patients who have displayed symptoms or have been identified as having risk of exposure. The CDC continues to advise us about additional tests on campus, and we will discuss with them and act on those recommendations. We've talked a lot at these meetings. Dr. Colfax and Mayor Breed have kept you informed about the continuing shortage of testing supplies. If we had unlimited supplies, we could do more tests. But even then, we would want to make sure that, again, our testing was informed by data, facts, and science. We've taken action in recent weeks to further mitigate the spread of virus on campus, including placing the entire Laguna Honda community under a preventive quarantine. This prevents community spread by having residents remain on campus and limits opportunities for the virus to be brought onto campus. We've stopped rotation of staff to various units and limited impacted areas to only the most essential personnel. We made the very hard but necessary decision in early March to restrict visitors on site. This week, in partnership with the CDC, we have escalated action to further decrease movement throughout the hospital and the campus to an absolute minimum to fight the outbreak and to reduce spread of virus. Laguna Honda is a very large campus serving 780 residents with approximately 1,700 staff. We've restricted access to the hospital by closing all but 2 entrances that are tightly monitored and controlled. Staff are medically screened as they enter and given a mask. Residents are not allowed to leave at this time. We've restricted access to any areas where residents may gather, including the library. Again, the California Department of Public Health and the CDC are providing much-needed clinical and epidemiological leadership and support to our own very strong DPH team to strengthen our approach, including the contact and tracing investigations, and we continue to test staff and residents based on their risk assessments. They've also joined the ongoing discussions about other long-term care facilities and how we can also help strengthen them and prevent outbreaks there. Laguna Honda is a top priority, and we are vigilantly working to contain the spread of the virus and protect the residents and staff that are there. We want to thank, again, everyone who has been involved in this very large and very important effort. These teams have brought knowledge and resource from their work all over the country and the world that's being shared citywide. We're very fortunate to have their help at Laguna Honda. Thank you. Now I'd like to introduce Chief Scott, who will say a few words.
Good afternoon, everyone. I want to follow the mayor's lead here and talk about the positives first. And I must say, overall, we've seen really good compliance in our city. We had really good compliance for the most part overall with social distancing last week. And this is thanks to, in my opinion, the proactive leadership of our mayor, our director of public health, and many other city leaders who jumped out in front of this. You know, we had some rain last week, and that probably helped as well, but this week has been a week of good weather, and we're still continuing to see, for the most part, compliance with our public health orders and our social distancing, but there are some challenges. And I'm going to discuss those in a little bit of detail to make sure that we all understand what's at stake here. There have been a couple of instances, or several instances rather, where we've seen social distancing challenges.